The practical application of the knee comes in two forms: regulating balance and distributing weight. For instance, in regulating balance, if I begin to do any balancing pose, let's say I bring this leg up to a half lotus position, if I'm going to go off balance, if I bend my knee, my center of gravity, which is located in my pelvis, lowers down, and then I can take control of that center of balance and straighten my knee again. In the second way, distribution of weight, this ties into what we're commonly told. Whenever we try to lift a heavy weight, we're always told to bend our knees. And by bending our knees, what we do is, instead of putting all of that tension of folding forward and then coming back up with all of that weight through our hamstrings and our back muscles, by bending the knees, some of that weight ends up in the front of the legs as well, the quadriceps. And so as a result of just simply bending the knees, weight is distributed through the body. So if I do a simple forward bend, if I did it with straight knees, folded forward, I would feel all the tension in my hamstrings. And if I come back up with straight legs, also feel that in my hamstrings. But now I'm going to bend forward with my knees slightly bent. If I soften those knees just a little bit and start to fold forward, the weight goes into my hips, into the front of my legs slightly, and also into my toes. And when I come back up that way, again, all of that weight gets distributed throughout the lower body. It doesn't go directly into the low back or into the hamstrings. This is not to say that at the end of the forward bend, your knee should be bent. Unless, of course, if you can't reach your toes, then you would have to bend your knees. So as I fold forward, if I take hold of my toes or if I'm grabbing my ankles, then the knee should try to straighten at that point. So forward bending, you should have straight legs. But to transition going into it, or now if I come out of it, if you bend those knees slightly, you can put more pressure into your feet to come up, which will distribute the weight through the thighs and the gluteals, instead of it being only in your hamstrings or in your back muscles. So let's look at some of these concepts and ideas that we've talked about with the knee as it relates to lotus. And lotus is one of those places that becomes sort of the measurement of what a yogi is. Often the images depicted of a yogi is with them sitting in a full lotus position. And unfortunately, lotus position can also be quite difficult for beginners. And injuries can happen from trying to get into a lotus too quickly, too soon, with the joints not open and flexible enough. So let's look at, one, how to get into lotus, and two, how to work with a knee that may have some pain in it. So give you some ideas of what you can do for yourself. As we make our way into lotus, a lot of what ends up creating problems in the knee joint, and we talked about kinetic chain, is the hip joint is actually quite tight. And so as I make my way into a half lotus, when I take hold of my foot, I never want to turn the tibia, the lower leg, inward. I actually want it going the opposite way, that is, outward. So when I hold the bottom of my foot or underneath my foot and support it, as my hip relaxes, because the femur is actually dropping, the tibia is rotating outward. So with the hip relaxed, I then draw the heel towards my navel. And this is a beginner's lotus. And so a beginner's lotus is generally wider. An advanced practitioner of yoga may have a very tight lotus. What we're trying to encourage here is that there's an external or outward rotation of the upper leg and an external rotation of the lower leg. So you see that on my body because the bottom of my foot is pointed more or less upward. And the outer edge of my foot is sitting in the crease of my hip. So if you look at it with the bones sitting over it, we're trying to encourage this bone, the femur, going this way, while this bone, the tibia, goes this way. What often happens is that they head towards each other. And when these two areas head towards each other, I'll stack my other model on. I'll fold it. When these two go towards each other, if you look in this area, you'll see that there's a pinching of the meniscus. And so if there is pain in your knee when you do a half lotus, there's a couple of things that you may try and see if they help. The simplest thing to do is to take your own two hands, one on your thigh, one on your calf, and move them away from one another. And what this is doing is helping to rotate the femur outward and the lower leg outward. If that releases the pressure in your knee, then what you can understand from that is you need more external rotation in the lower leg and external rotation in the upper leg. There's a couple of ways to encourage this. And if you need it and you find that this works, and something important I should say is these are all options. Not any one of them is the fix all of the time, so you may need to experiment. So what I'm going to do is show you a way in which you can do this without using your hands. And what I'm going to do is I'm going to open my knee up slightly. I'm going to use a plain old yoga strap. I'm going to wrap it from the top to the bottom, and then I'm going to pull both of these up through and underneath my knee. I'm going to slide them up just a little bit. I'll just bring my lotus in a little bit. If I now pull on these two straps, you'll see that it moves the tissues of my leg outward once again and separates those two areas in my knee from one another. One of the simplest things to do for a knee that has a little bit of pain in it is to simply put a block underneath it. And what I often find with people with a small amount of pain on the inside of their leg is that the lower the leg goes, the more that sensation increases. And this is an indication of tension at the hip joint. Because what's restricting it from going down easily are the muscles on the inside of the thigh, which we're going to talk about in the hip joint. So until they open enough, you want to have a certain amount of tension on those. Simply lift your leg up. That should release some of the tension. If it does, you may then want to support it with something underneath. And yet another option, again, this may work for you, this may not, is to simply put a small towel inside the knee and then fold your leg. And for some people, what this does is it creates a little bit of a spacer between the two bones. And as a result, they move slightly away from one another, what we would call almost like a distraction away from one another. And as a result, maybe creates just enough space you don't feel any pinching on the inside of your knee. As we make our way to the hip joint, which is